Thank you so much, Divya. It's really a pleasure to be here, and wow, a lot of friendly faces, longtime friends, people we've worked with in many countries through the LAICO initiatives. This is just wonderful. Thank you all for being part of this celebration, which of course I can just imagine how Chief is very happy today, knowing that we're celebrating this development of the LAICO's and Arvind's efforts, which, as Tulsi put so well, is the effort to develop people for Arvind and for everywhere. I think that really says it all. I'd like to focus really on two words in the name of the institution: institute and community. The term institute, Arvind Institute, started to be used in the mid-1980s when Dr. Venkateswamy knew he wanted to do something more than simply tackling the hospital system development. He knew there was more to be done, and that the way to do that would be through broadening a systematic channel for collaboration with many institutions around the world. So with Seva board and volunteers and friends, and of course the senior leadership of Arvind, the conversation began in the mid-1980s of what would this Arvind Institute look like. So there was a long developmental process, kind of a germination. And the first formal meeting I can think of, and Fred was there, it was in Ann Arbor, it was in, and Tulsi was there as well, and Dr. V. It was in Ann Arbor. It was in 1988 at another institute, the Institute for Social Research at the University of Michigan. We hosted a meeting to get an idea of how would one blend spirit, social research, and the science of providing broad-based eye care. And the results of that meeting, that involved numerous social scientists and faculty from the business school at the University of Michigan, it involved people from School of Public Health, the medical school, we got a sense that there really was something to this idea of an institute. This then led to a multiple-year process, which back then, remember, in the late 1980s, to communicate, one used a fax machine or a telex machine, or sent mail, snail mail, that took a good 2 weeks to go each direction from India to the US, and another 2 weeks to come back. So using all the available technology, we then developed the plans for a meeting that would be held in Madurai. Getting ready for that meeting was a big job, and a person ready for a big job was Professor Fred Munson. Fred volunteered, and we instantly snapped up that raising of a hand. Professor Munson volunteered to contact 22 leaders in global eye health to identify, would they think there was any way that their work in global blindness prevention could be assisted or accelerated by having a core institution somewhere in the world? And what would they think about that institution being based at Arvind Eye Hospital in Madurai? And Fred contacted the 22 people, got their results. It's a beautiful report. It was a resounding positive response from leading international eye care organizations and other major eye hospitals around the world who truly desired to have a way to accelerate their learning and be able to reach more people. And multiple of the respondents said, what better way to do that than having access to the Arvind Laboratory. So with that, and we had a really very impactful meeting in 1990 right here in Madurai, And Fred was there, Dr. Pararajasegaram, members of the Seva Foundation board and the senior leadership here at Aravind. And that really crystallized the idea of the Aravind Institute. And as you just heard in some of the earlier presentations, it was just excellent timing that this coincided with Lions Club's International Foundation establishing the Sight First program, and they were looking for a flagship project. Aravind had a beautiful roadmap in the preparation stages for the Institute, and it did become the Aravind Institute became the Lions Aravind Institute, and received the initial grant from Lions Clubs International, for which, of course, everyone is so very grateful. The Institute was purposefully designed not to solely be a repository of academic knowledge, but as Fred said so beautifully, the purpose was that it would be important for the living laboratory of Aravind and what people could learn from each other at the Lions Aravind Institute to take prominence over academic learning. There would be academic, but there should also be a very active experiential component, and there should be a very deeply personal component to this institute, so people would draw inspiration as well as tools to get their work done. So after the development of the Institute, and we've been able to witness through the stories and the videos, we've been able to witness the blossoming of this work over this 25 years. I'll just fast forward about 20 years or so to a period where Aravind and LAICO and Seva worked very closely on developing a number of toolkits to help institutions around the world. And those included the Quality Cataract Surgery series, which was the answer to the question that was coming from so many eye hospitals in the world: where do we begin to start a quality cataract program? So the 7-volume Quality Cataract Surgery series was the response to that, and it's still a very popular document available on PDF through the Aravind website today, many downloads. There also was a very strong yearning from within Aravind and also from many hospitals around the world to have better tools for teaching ophthalmic assistants, and that led to the development in the early 2000s of the OATS series, the Ophthalmic Assistant Training Series of 7 volumes. When we had the release party for those 7 volumes, we were then told that just learning what to teach wasn't enough. A lot of partner hospitals needed to know how to teach, and that led to the development of the IXL workshop, which we heard referred to earlier. The IXL workshop today has been offered 13 times, 11 at Aravind and 2 in other countries, and during that time 400 people from 150 hospital teams from 30 countries have been exposed to knowledge base of how to strengthen or initiate their own training program in their own hospital. Even oral lab team members once came for the workshop and developed a training program within oral lab for this purpose. Along the way, working with RMS and the team here at Aravind, we were also able to bring out the Community Outreach Manual, which is a massive and major resource for any organization that wants to truly engage with the community. So I will close with, in fact, focusing once again on that word community and the fact of the Aravind and Seva relationship developing this global initiative. It was mentioned earlier that the last meeting Dr. V was able to attend personally was in March 2006, right here in this building. And that was really the launch for the Global Sight Initiative, which has been a very substantial vehicle for Aravind to work with peer organizations around the world and also to help develop more peer organizations around the world who in turn can mentor, train, and inspire eye hospitals in their own region. So we're very happy that today, just to update the numbers a little, there are now 10 mentor institutions and 100 collaborating partner hospitals working in the Global Site Initiative. And this is very much the fruition of Dr. V's vision. So thank you again. It's lovely to be here.